Hi, I'm Parsaid. I know I will have pronounced your name wrong. This video is unlisted for the moment. I made listed, but I just wanted to give you an opportunity to respond one-to-one before making it public or posting it anywhere. Right, your pain scores for outpatient hysteroscopy are that high that it means there's a skill issue. They simply, at the current level of skill, they should not be doing them. I know you said that they started to use the RCOG leaflet. The issue with that is that they give, pretty sure, I know the BSSGE one does not, but the RCOG one does, and the problem is that percentage is just not realistic. The problem is, where do we go from here? Do we, the moment you could, maybe with a proper simulator, a traffic light one that shows the skill level of, in the, I know the Italian one used one where they have to get 8 out of 10 before they can proceed. You have the advantages. I know they're very, very expensive, but at the end of the day, you've got 3 hospitals. You've got the charity there. You need to get a simulator that measures their skill level before that you can determine where they're at. The issue is that where do we go from here? You can go down 2 routes. You can go down the honesty route, because at the moment you say you give women the choice of a GA, but you're not being honest with them about the risk of severe pain. The reality is that your leaflet should read, most women suffer severe pain. And I mean, there are things we can do to reduce this, like gas and air, and how many times from the Freedom of Information Act have you responded, that's not in the guidelines, but that's not the point. Is you're meant to be doing stuff to reduce pain. Ibuprofen is not a gynecological painkiller and has no effect on procedural pain, so let's rule that out. That helps with after, but it doesn't help with, I know some women, many people have NSAID issues, they can't take it, but the Green Top guidelines does allow some opioid use, so perhaps that. But in my opinion, you've got to face the fact that even if you, right, let's see you assess their skill level, but at the current level, the pain score suggests that they shouldn't be doing outpatient hysteroscopy. They should be moved, I wouldn't say sacked, you could move them department, or at the end of the day, they should not be doing it. And I know they're very hard to replace with the staff shortages, and it goes on and on and on and on and on. But at the moment, you are hurting women to such a degree that they will refuse or delay further treatment to the point that it is dangerous. Do not think that this is not putting them in danger. That this is that they walk out of the clinic and there's no further issues. That was another issue. Perhaps you're trying to actually offer sexual counselling, sexual health counselling after, psychosexual health counselling after, and perhaps try and measure, although not ask for any details, see how many referrals you get from the clinic. As I say though, I have a big issue with the pain scores that were monitored, 7s, 8s, 9s and 10s. None of them were converted to a GA, which means no one is being their advocate. No one is being their advocate. That's another issue with training. I'm going on about the gynecology, so hysteroscopies, whatever you use. At the end of the day, whoever's being present, HA or nurses, are not doing their job. They are not doing their job. They are neglecting their care of duty. Do not think that they're just thinking they're trying to get them through it and they're doing their best. No, they're not doing their job. I can give a reference from Lee Walsh at Kingston Hospital. And normally I am far more productive and far more wouldn't say balanced, but negative. I can give a reference. I'm not normally this negative, but the way it's run at the moment, you shouldn't be doing outpatients without conscious sedation. You need something. This needs to stop. Do not think. The problem is with, say, Kingston, there was a complaint on Care Opinion. That was down to a lack of communication. This is far more fundamental. Unless you change something radically soon, do not kid yourself that this will result in ultimately death. And I don't necessarily mean immediately, but 5, 6, 10 years down the road, when they've had a fibroid that's actually cancer, and they've left it because they've had such a horrific time at the clinic, and they haven't sought further treatment. It has consequences. So as I say, I have not listed this. I know I've gone on for a bit rambling. I have not listed this. I'm going to give you a chance to respond to this and see what you think. I probably might try and register a complaint with PALS. I do know that sometimes they don't always take complaints from concerned members of the public. Sometimes they do. But if you actually want to change things, actually make a difference, you need to... There is no tweaking. That's the issue. There is no tweaking. You need a radical reset of how procedures. Okay, thank you. Bye.